The meniscus acts like a shock absorber in the joint between the femur and the tibia. There are two menisci, medial and lateral. They suffer from two types of trauma. The first is a flap with a mobile fragment in the joint between the femur and the tibia, causing pain, discomfort, and cartilage damage due to rubbing of the cartilage. The meniscal bell clapper must therefore be resected using small pliers, and finally rectified using a small surgical knife with a vacuum system. The second type of lesion is peripheral, that is to say, located around the edge of a well-vascularized area where the meniscus can heal. Miniature suturing instruments are used to repair the lesion. Several stitches help the lesion to heal rapidly, preserving the entire meniscus. This surgery is performed arthroscopically through small incisions using a camera to visualize the joint, minimizing scarring and enabling faster recovery.